promising trend we're seeing in our local hospitals of fewer and fewer in-house COVID patients.
Finally, some good news to report, right? But right now at University, 98 patients. That is the fewest they've had since December 15th. AU Health down to 63 patients, the fewest they've seen since the 11th of December. Doctors Hospital, 61 patients, 17 less than Friday.
To put those numbers in perspective, this is a graph we've put together of new cases every day at our local hospitals. There's still a lot of patients in-house, but you can see that is starting to trend down, which is good news. Now there's some hope for hospitals that things could slowly start getting better.
Brady Trapnell looks at the progress our hospitals have seen in the last month.
It's about half of what we had previously.
Since the peak of more than 120 patients, AU Health has come a long way. This morning, there's 63 patients in their COVID units.
We are seeing a decline in numbers. We are seeing less admissions because of COVID.
Health officials say numbers are down for two reasons. There's fewer admissions, but there's more deaths.
We kind of see a lag of about 10 to 21 days or so between a spike in cases and unfortunately when the deaths occur.
AU Health says their monoclonal antibody therapy clinic is full every day, and officials say it's helping keep numbers down.
And it was a blessing because almost immediately during the treatment I began to feel better.
Brendan Francois is one of more than 225 patients AU has treated in their antibody clinic. He's 62 years old with comorbidities or high-risk conditions.
I do believe that getting that immune therapy kept me from a more severe condition.
I still believe that the data will bear out that the impact of using monoclonal antibody therapy is significant.
Dr. Cool says it likely prevented a large number of their more than 200 antibody clinic patients from hospital admission. This as AU plans to vaccinate its first 1,000 people in Aiken County later this week, taking on a big issue across the community.
There's really not anything in of substantive vaccination efforts that's occurring west of Columbia.
A trend both AU and University Hospital hope to change. Reporting in Augusta, Brady Trapnell on your side.
It's not just hospitalization seeing a downward trend. This is a graph from Georgia's Department of Health, and the blue lines show new cases each day. The yellow line shows the 7-day moving average, which you can see is definitely trending down. That's the lowest the average has been since December 14th, since before the holiday spike. Today, Georgia saw 2,500 new cases, the fewest new cases they've seen in almost 2 months. Georgia Governor Brian Kemp mentioned that trend today, along with the decreasing percent positivity rate at 11%. He was asked if AU Health would be considered for a mass vaccination site when the time comes. He says he wouldn't give specifics, but they are exploring every option.
When that day comes, if it's Johnson & Johnson, more Pfizer, more Moderna, whatever it is, that we're ready to roll. If that includes Augusta University and other partnerships, we'll do it. We're just trying to figure out what's the most efficient way to do that.
Governor Kemp today, and like Georgia, South Carolina also saw a spike in daily cases in January, but if you check this graph from DHEC, you'll see the Palmetto State also trending in the right direction as well. 14 straight days of fewer than 4,000 cases. Governor McMaster spoke about vaccines today and says he wants to expand distribution as soon as possible, but right now, older folks are the priority.
It is the older people we know that are most at risk. The average age of death from the virus in South Carolina is 75 years old. So it is the older people that are most at risk, and those are the ones that we must see have the early opportunity to get a vaccination.
One group wants South Carolina to completely change how they're distributing the COVID vaccine right now. DHEC ships doses to counties based on population per capita as it stands right now.
But South Carolina AARP argues DHEC should consider each county's age and vulnerability. Sydney Heiberger shows us what's at stake.
Hank Pavanelli is 73, a veteran and a cancer patient, but he still hasn't been able to get his COVID vaccine.
I should be the head of the line.
Crystal Durden cares for her 89-year-old mother-in-law. After weeks of trying, she finally got an appointment more than an hour away.
We shouldn't have to drive that far away when we have so much medical resources here.
DHEC announced they'll roll out the vaccine using a simple per capita method. Each county gets doses based on their population. Aiken County would get 1,900 doses a week, Edgefield 300. But that method leaves out vulnerable populations in smaller counties.
I can't tell you how disappointed our community is and how scared our community is.
95% of COVID deaths come from people older than 50. And a new AARP study shows out of 14 leading causes of COVID morbidity, older African Americans are disproportionately affected by 12 of them. So if DHEC were to distribute vaccines not only based on population, but also by the county demographics, Aiken County would get 200 fewer doses every week, and Edgefield, which has a higher proportion of elderly people, would get 250 more.
We feel like those populations must be prioritized, not only for their benefit, but for us to get on the other side of this global pandemic.
Everyone agrees whoever wants a shot will eventually get one. The fight remains when. In Aiken County, Sydney Heiberger on your side.
In Georgia, the state does not distribute vaccines on a per capita basis. We checked the vaccination plan on the Department of Health's website and found that this distribution is focused on reaching defined critical populations, but the plan does not elaborate on how they calculate that.
Taking a look out over Whiskey Road on a cold, sort of dreary a little bit.
Thank you, Riley. With 2020 in the rear view, something else is coming into focus: skyrocketing gun sales.
The I-Team found a record number of guns sold in 2020. The I-Team's Meredith Anderson uncovered what was behind the boom and why it could mean big business for Georgia's economy.
Good. She's a better shot than
I was scared to death.
Yeah.
I'm not going to touch a gun because, I didn't know anything about them.
Now, Patty Morningstar is more than just comfortable shooting a gun. She's confident.
First time I shot was bullseye.
Yeah, I got her a little .22 revolver.
Shooting isn't new to her husband, Bill, who retired after decades in the Army and decades of handling a gun. But he encouraged his wife to get a gun last year, making her one of hundreds of thousands of new gun owners during 2020, a year that saw a pandemic, social unrest, protests, and a polarizing election.
My business increased threefold during that time.
Gary Slater is a local firearms instructor.
Have you ever seen it like this?
Never. And it's just because people were scared. I've trained people as old as their late 80s, and I train youngsters as young as 7.
The I-Team examined FBI records to analyze just how much gun sales soared in 2020. We found 5 of the top 10 days for criminal background checks, which are required to purchase a gun from a federal firearms dealer, were in the week leading up to the shutdown from the pandemic. The number 1 day in history is now March 20th, 2020, with more than 210,000 background checks in a single day. 4 other days that very same week, March 17th, 18th, 19th, and 21st, all made the top 10 list for days in U.S. history. Arthur Peralta is the special agent in charge for the Atlanta Field Division of the ATF. The Bureau of Alcohol, Tobacco, and Firearms regulates the gun industry.
But those 5 days consecutive, does that surprise you?
I would have to say yes and no. Typically, we see gun sales go up during election year, things like that. And I think that, during the beginning of this pandemic, it was so uncertain.
Special Agent Peralta says the public shouldn't tie gun sales to a potential rise in crime, noting guns used in crimes are often stolen and not purchased legally.
Most responsible gun owners will keep their guns for their entire lifetime.
Step on in, Shane. I want you to watch.
For Slater, it's the clients he usually doesn't see to train on firearms that make 2020 stand out the most.
I started seeing clients that showed up that would tell me, I hate guns. I've had clients show up that fired one shot and busted out crying because it was against their ideology or their political leanings, but yet they came and stayed for training. So I did see it go across the conservative and the maybe not so conservative movement.
Have you seen a shift in maybe some types of people in some professions that may have not come to you before that are like now, I need some protection?
Absolutely.
He tells me that includes doctors and nurses and other professions impacted by COVID-19. The I-Team found gun sales impact us locally in another way, too. The economy. The National Shooting Sports Foundation released this industry report on 2020. We found Georgia made the top 10 list for states with the biggest economic output from the gun industry, and also the top 10 for jobs tied to the firearms and ammunition industry, with 4,435 direct jobs and more than 2,300 other jobs linked to suppliers. The report notes recent gun sales have been nothing short of remarkable. But with that comes responsibility, says Special Agent Peralta.
The number one thing that I always talk about is make sure you secure your weapon. You know, you make sure you put a lock on that gun, or make sure that you put it in a safe.
Watch the target, watch my hands.
And Slater says, take a gun class and get familiar with the weapon, just like Patty Morningstar, who's come a long way in 4 short months.
The guys are saying, yeah, if anybody came to your house, just
you need to
all
protect
they
yourself.
have to do is wake you up.
Wake her up to
Wake
protect
me up
yourself.
to protect him.
Since there are so many new gun owners, the ATF says there is some more advice they have for you that might seem obvious, but they say it's actually not. A lot of people don't do this, but you need to make sure you write down the make, the model, and the caliber of your gun, and most importantly, the serial number. They also suggest you take a picture of it and keep it with your records.
So we've established demand is high, but what about supply? Tomorrow, the I-Team looks at an ammo shortage and why that has some experts concerned. We're told things probably won't get back to normal until 2022. New tonight, Bobby Christine stepping down as U.S. Attorney for the Northern District of Georgia. He just resigned today. Christine is still the U.S. Attorney for the Southern District of the state, and now we're learning Kurt Erskine is taking over the Northern District. Christine started juggling both positions after the sudden resignation of U.S. Attorney B.J. Pack.
Congressman Joe Wilson in North Augusta today telling us what his focus will be this
From tomorrow.
A public servant in Augusta for more than 15 years could live on after his death, but the decision of whether to name the Augusta Utilities Building in honor of Public Utilities Director Tom Wiedmeyer was postponed today. Now there won't be a decision about that until April. Wiedmeyer died back in August due to complications from COVID-19. Today is the beginning of Black History Month, what a local museum has planned to remind people about one part of town that once thrived.
Me first. I'll handle the insurance company.
Teacher groups in South Carolina say calls for a 5-day a week face-to-face learning, that's unsafe, but the state superintendent and the governor are both pushing for in-person learning. State House reporter Adam Mincer spoke with our state school superintendent Molly Spearman one-on-one today. So what's her argument for this face-to-face learning, Adam?
She's really concentrating on the data and the science, she says. She's looking at the recent guidance from the CDC that in-person learning is safe if all CDC guidelines are followed. She's also looking at data from the Medical University of South Carolina, specifically in Charleston, showing that only 1% of students and staff in the school district actually got COVID-19 from the fall till right now during the winter. She's really concerned, though, about the mental health of children and also slips in their ability to do some of their coursework. She says that specifically she wants this face-to-face learning to happen to make sure that these students don't fall behind and that she would actually teach in person, given how safe she feels the schools are right now. She also says that it's important to bear in mind they spent about $100 million on new different areas like PPEP to really keep students safe. She says that those tools need to be put to use.
There's a lot of money flowing, and I would say that again to the teacher groups who are so worried about going back to school. Look at all of what we've done to make the classroom safe for you, and try it out. I know there's a lot of fear, but fear should not be the determining factor.
This achievement gap is also concerning lawmakers. Just a couple blocks away at the State House, there's a bill calling for students to complete federal testing this year to see how far behind some students in our state really are. Now, just to be clear, Spearman is against this specific type of test in this specific bill. And she has actually asked the Biden administration to waive this testing requirement this year, as was done last year under the Trump administration. She doesn't want to use these federal tests to assess our students, and she thinks of it as more time outside the classroom. Actually, these tests are required to be done in person, so that's an extra burden. Instead, she wants to use the normal semester testing that happens every year in the spring to really determine whether students are falling behind, whether specific students need summer learning or extra concentration on specific course areas. That, she says, is the best assessment. Reporting live from the South Carolina Department of Education, Adam Mincer, on your side.
Adam Mincer in Columbia for us tonight. Adam, thank you.
Today is the beginning of Black History Month, and the Laney Museum is working on a big project to teach us about the history of the Laney Walker area. Kennedy Harris live along Laney Walker Boulevard. So, Kennedy, what do they have planned?
This mural behind me marks several points of interest in Augusta's Golden Blocks neighborhood. This was created in 2019, and it's one of the several art projects telling Augusta's Black history through art. History you don't hear about too often.
Unfortunately, we have lost a lot of the original structures in the Laney Walker Bethlehem corridor. They've just been torn down over the years.
Is now being told through art.
It's not stories that are told only within a small group of people. It's a story that's now being shared with everyone.
The Laney Walker area was once known as the Golden Blocks, and now the Lucy Craft Laney Museum and Greater Augusta Arts Council are finding a way to tell that story.
These African American entrepreneurs were able to thrive with the backdrop of segregation looming large over the South and the country at the time.
Using the work of local artists, the $20,000 Golden Blocks art project illustrates the story of the once thriving Black business community.
All of your businesses, and you had your lawyers, and you had your doctors, and you had your educational institutions.
Phase 1 looked at businesses. Now Phase 2 will focus on historic educational institutions.
This is our way to use our culture, use our history to set us apart from other cities by channeling that history and culture into public art.
And both Corey and Pax say this art project has no specific end goal. They want to take it as far as possible.
So many stories to tell. Thank you for that, Kennedy. And they are looking for 2 local artists for Phase 2. Comes with a $7,000 stipend. So if you want to apply, you can head to our website for the details there. Riley?
Well, weather-wise today, we did